Well, we're trying to get the best evidence, just like we made the original health decisions from the best evidence that we could find, and Ohioans really came through and flattened that curve and did the job. The job's not over, but as the Lieutenant Governor indicated, and I think he went into pretty good detail, there's a great price to be paid, and that is not only an economic price, but there's a health price that Ohioans are paying and will pay for this drastic reduction, shutdown of the economy. So we weigh those things out and try to make the decision that's in the best interest of Ohio and the people of the state of Ohio. And I've said all along that this is going to be an Ohio decision made by Ohioans, for Ohioans, with Ohioans. I consulted and continued to consult. I actually continued at a call yesterday morning early with a number of doctors and health experts. But just as we've consulted throughout this with the health experts, we also put together a group of businessmen and women, some bigger companies, but frankly some companies that you probably never heard of, the CEOs of those companies as well, and tried to come up with the best practices that when we start back, that we can do it in a safe way. And we will have more this week about how that's going to work. But it's imperative that as we start back, we do it carefully. It's also imperative that we do it in the best way possible from a medical point of view and from the point of view of trying to protect the employees and trying to protect any customers who might come into a retail business. So it is a balance. It is trying to strike that balance where we keep the number of coronavirus incidents, a number of people who get it down, where we try to protect, people who are older, people who might be more vulnerable, but also have very, very strict and understandable guidelines for businesses that do, in fact, want to open. We, as Dr. Acton indicated and I indicated yesterday, one of the things that we know we must get moving at a much higher rate is testing. And I don't have any announcement today, but I will share with you that I ask, as you know, I asked Governor Celeste, former Governor Taft, to head up a group to really focus on testing. They were on calls late last night with our team and with others this morning. I had a very significant call this morning. We're going to have something to announce about that. So we have some good news. It's not done yet, not signed and sealed, but the ability to test and to test in depth and do the tracing, do what is the right thing to do, not only for that individual but for everyone, and that is when we find someone who tests positive, to be able to interview that individual if they're willing to do it, and most people are, and then find out who they've been in contact with, and then go down and try to make sure that we get aggressive about this disease, about this virus. And so I'll have more tomorrow, day after, about how we're doing that. But I'm much more optimistic today than I was even yesterday about our ability to test, and optimistic about our ability to do the proper tracing with local people, with health workers who will be paid to do this, and who will be doing work that is vitally important to keep us all safe. So I'm optimistic. We'll have more tomorrow.